What we worked on here was describing a blueprint to control the current COVID-19 pandemic, specifically talking about the triad of non-pharmaceutical interventions, immunity, and treatment as prevention, and how the whole really is greater than the sum of its parts. I am Dr. John O'Horo, an infectious disease specialist at the Mayo Clinic.
My name is Andrew Badley. I'm a professor of infectious disease, professor and chair of the Department of Molecular Medicine, and chair of the COVID task force at Mayo Clinic.
And we will be discussing with you the blueprint to control the SARS-CoV-2 pandemic that will be appearing in the May edition of Mayo Clinic Proceedings. Looking at the current pandemic, a key thing to understand is the concept of the ID50, the infectious dose 50, or the number of pathogens that it really is needed to cause an infection in about 50% of those who are exposed. This is proportional to the basic reproduction number, or R naught, and really dictates how fast the pandemic spreads. The goal of many of the interventions that we've done so far has really been to decrease the amount of exposure and get it well below that ID50. Looking at the non-pharmaceutical interventions that have been put into place as the first line of defense, we've been using things like masks to try to reduce the amount of droplets and aerosols that are spread from person to person and the distance that they travel, using distancing to accomplish much of the same, and looking at efforts to control crowds by canceling public events and limiting private gatherings to reduce the opportunities for spread to occur. The overall impact of these is to reduce the amount of virus that's really available for spread and can go from area to area. Now I'll hand over to Dr. Badley to talk about diagnosis or treatment as prevention.
So another concept that's key to understand is the impact of early diagnosis and treatment on the potential to spread the virus. We know that if people are diagnosed early, they may take some interventions to reduce their ability to spread the virus, such as self-quarantine. Also less appreciated is the impact of treatment. We know from other diseases that are viral infections that when antiviral agents are used, the amount of virus is less and the ability to spread that virus is reduced. It appears that the same is true for SARS-CoV-2. For example, when people are treated with remdesivir, the amount of virus that's shed in their nose goes down quicker than if they aren't treated with remdesivir. So together, early diagnosis that leads to quarantining and early treatment that reduces the amount of virus which is present together add synergistically to reduce the likelihood of spreading infection to others.
Acquired immunity is the third part of this tripod here, where we're looking at either the combination of immunity acquired from infection or now more commonly the immunity you get from vaccination. The obvious prevention of this in the individual isn't the only effect that we're seeing from this, but we're also seeing that there's a reduced prevalence of symptomatic infection and presumably less carriage of the disease. This means that even if an individual who's vaccinated is still capable of getting an infection, presumably they'll be less capable of transmitting as they'll have less virus to shed. So the combined effect of immunity over time between both vaccination and naturally acquired immunity has had some impact on this. And we've seen this in some of the early population-based studies in Israel following the vaccine. I'm going to hand this back over to Dr. Badley to bring these concepts together.
So the key message of this editorial is that while each of these interventions alone has some ability to reduce spread and control the pandemic, that really the maximal control of the pandemic will require the synergy of all three. And what that means practically is that once you're vaccinated, you should still maintain your public health interventions. When you are treated, you should still consider getting a vaccine afterwards. All three together will be required for all of us to take control of this pandemic and to stop the inexorable spread that we've seen so far. Thank you very much for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.